Imagine you're at dinner with your family. Your uncle suddenly clutches his chest, looking pale and sweaty. Everyone panics. Is it a heart attack? Someone reaches for the phone, but before help arrives, he collapses to the floor, motionless. Now everyone's even more confused. Did the heart attack cause this, or is it something else entirely? In this kind of situation, seconds feel like hours, and the right knowledge can mean the difference between life and death. That's why today we're breaking down two terms people often mix up: heart attack and cardiac arrest, and showing you exactly how to spot the difference, respond instantly, and save a life. A heart attack, or myocardial infarction, happens when the blood flow that feeds part of the heart muscle is suddenly blocked. The most common cause is a buildup of plaque inside the coronary arteries. Those are the vessels that carry oxygen-rich blood to your heart. Plaque is made of fat, cholesterol, calcium, and other substances. Over time, it can harden or rupture. If a rupture occurs, the body tries to repair it by forming a blood clot, but sometimes that clot completely blocks the artery. Without fresh oxygen supply, the affected part of the heart muscle begins to die within minutes. This is why doctors say time is muscle. Every minute of delay means more damage. Heart attack symptoms are often dramatic, but not always. Classic signs include chest pain or pressure that may feel like squeezing, fullness, or even heartburn. This pain can radiate to the shoulders, arms, back, neck, jaw, or stomach. People might also experience shortness of breath, breaking out in a cold sweat, nausea, vomiting, lightheadedness, or unusual fatigue. In women, older adults, and people with diabetes, the symptoms can be vague, like sudden weakness, indigestion-like discomfort, or mild breathlessness, which is why heart attacks can sometimes go unnoticed until it's too late. Now here's where the confusion starts. A heart attack is not the same as a cardiac arrest. Cardiac arrest is when the heart suddenly stops beating altogether. This is not caused by a blocked artery, but by an electrical malfunction in the heart's rhythm. Your heart has its own built-in electrical system that controls how it beats. If that system misfires severely, for example, causing ventricular fibrillation or pulseless ventricular tachycardia, the heart can no longer pump blood to the brain and other vital organs. The person will instantly collapse, lose consciousness, and either stop breathing or take occasional gasping breaths called agonal respirations. Without immediate help, death can occur within minutes. Here's the key difference in urgency. A heart attack is a plumbing problem, blocked arteries. It's deadly, but sometimes you have warning signs and a bit of time to get help. Cardiac arrest is an electrical problem. The heart stops pumping. It's instantly life-threatening, and without CPR and defibrillation, survival is unlikely. One important point: a heart attack can lead to cardiac arrest. If enough heart muscle is damaged during a heart attack, it can trigger dangerous arrhythmias that stop the heart. But cardiac arrest can also happen in people with no history of heart disease. For example, due to trauma, drowning, severe blood loss, electrocution, or inherited heart rhythm disorders like long QT syndrome. So, how do you respond to each? If someone is having a heart attack and they're still conscious and breathing, call emergency services immediately. Keep them calm, seated, and still. If they have prescribed nitroglycerin, help them take it. If they are not allergic to aspirin and there's no risk of bleeding, they can chew a regular aspirin to help thin the blood. Monitor them closely because their condition can change fast. If someone is in cardiac arrest, unconscious, unresponsive, not breathing normally, this is not the time to look for aspirin. Call emergency services, start CPR immediately, and if an automated external defibrillator, AED, is available, use it as soon as possible. Push hard and fast in the center of the chest at a rate of 100 to 120 compressions per minute. About the beat of the song, "Stayin' Alive." If you've never used an AED before, don't worry. It will give you voice instructions. Every second matters. Survival chances drop by about 10% with each minute that passes without CPR or defibrillation. Now let's talk about prevention, because the best way to survive a heart-related emergency is to avoid it in the first place. For heart attacks, prevention focuses on protecting your arteries. This means maintaining a healthy diet low in saturated fats and trans fats, exercising regularly, not smoking, managing stress, and keeping blood pressure, cholesterol, and blood sugar in healthy ranges. For cardiac arrest, prevention is a bit more specific. People with known heart rhythm disorders may need medication, procedures like ablation, or even an implantable cardioverter defibrillator, ICD, a small device that monitors the heart and delivers a shock if it detects a dangerous rhythm. Athletes in competitive sports sometimes undergo screening to detect hidden heart problems before they cause sudden cardiac arrest. Both emergencies are scary, but the takeaway is simple. A heart attack is a circulation problem. A cardiac arrest is an electrical problem. One might give you a warning, the other almost never does. But both demand fast, decisive action. So next time you hear about someone having a heart episode, remember, knowing the difference isn't just medical trivia, it's life-saving knowledge. If you recognize the signs of a heart attack, you can get help before it becomes a cardiac arrest. And if someone collapses from cardiac arrest, you can be the one to keep them alive until help arrives. Seconds matter, and the actions you take in those moments could give someone the greatest gift of all, another chance at life.